Navigating the shadows, reactivity, and perception in relationships with self-destructive partners, understanding dynamics and impacts in complex emotional landscapes. In relationships where one partner exhibits self-destructive behaviors, the emotional and psychological dynamics can be deeply complex and fraught with challenges. These relationships often operate within a shadowy realm where reactivity and perception play critical roles in shaping interactions and outcomes. Partners of those engaged in self-destructive acts frequently find themselves reacting to crises and behaviors that can destabilize the emotional health of the relationship. This article explores the nuances of reactivity and perception in relationships affected by self-destructive behaviors, distinguishing between minor acts of rebellion and serious criminal actions. It aims to provide a compassionate, in-depth look at how to navigate these difficult waters effectively. The role of reactivity in relationships. Defining reactivity, emotional responsiveness. Reactivity in this context refers to the emotional responses triggered by one partner's self-destructive actions, such as substance abuse, gambling, or reckless behavior. This can include feelings of anger, despair, helplessness, or urgency that compel the non-destructive partner to respond in ways that might not always be healthy or constructive. Behavioral patterns. These emotional responses often lead to behavioral patterns where the non-destructive partner may attempt to manage or control the situation, sometimes enabling the behavior inadvertently. Impact of high reactivity. Escalation of conflict. High reactivity can lead to increased arguments, heightened tensions, and a deteriorating relationship environment that can be emotionally taxing for both partners. Enabling and codependency. In trying to manage their partner's issues, highly reactive individuals may fall into patterns of enabling, taking actions that inadvertently support or encourage the destructive behaviors. Perception and its consequences. Influence of perception on relationships. Distorted views. Partners may come to perceive the self-destructive behaviors as less severe due to rationalization, hope, or misinformation. This distorted perception can lead to underestimating the seriousness of the situation and delaying necessary interventions. Perception of control and leadership. Self-destructive individuals may sometimes be perceived as assertive or dominant leaders because their risk-taking or nonconformist behaviors mimic those traits superficially. This perception can complicate the dynamics, making it harder for their partners to address the issues objectively. Managing relationships with minor acts versus serious crimes. Navigating minor acts of rebellion. Understanding the scope. Minor acts of rebellion might include occasional excessive drinking, experimental drug use, or minor gambling. These acts, while potentially problematic, generally do not carry the immediate and severe risks associated with serious crimes, but do require careful management to prevent escalation. Strategies for management, effective communication, and boundary setting are crucial. Therapy might focus on developing these skills within the relationship, helping partners to react appropriately without enabling or escalating conflicts. Dealing with serious criminal behaviors, recognizing the gravity. Relationships involving serious crimes, such as drug trafficking, significant financial fraud, or chronic severe gambling, pose substantial risks to both partners. These behaviors necessitate a more rigorous and immediate response. Intervention and safety, legal advice, therapeutic intervention, and sometimes law enforcement are necessary to manage these situations. Partners must prioritize safety and legal considerations, often requiring support from professionals in navigating these challenges. Strategies for navigating reactivity and perception. Improving emotional intelligence. Self-awareness. Building self-awareness about one's own reactivity patterns is crucial. Mindfulness and reflective practices can help individuals understand their triggers and responses, leading to more controlled and thoughtful interactions. Emotional regulation, techniques such as DBT, dialectical behavior therapy, can be instrumental in helping partners manage their emotions more effectively, reducing the intensity and frequency of reactive behaviors. Enhancing perception accuracy, education and information. Understanding the true nature of addiction and self-destructive behaviors can help correct misperceptions. Educational programs, therapy, and support groups like Al-Anon can provide valuable insights and factual information to dispel myths and clarify realities. Open dialogues. Encouraging open and honest discussions about behaviors, consequences, and feelings can help both partners maintain a more realistic view of the relationship's dynamics. This is crucial in adjusting perceptions and expectations appropriately. Conclusion: relationships with self-destructive partners challenge the emotional and psychological resilience of both individuals. Successfully navigating these relationships requires an understanding of the complex roles played by reactivity and perception, By fostering emotional intelligence, enhancing perception accuracy, and applying differentiated strategies based on the severity of the behaviors, partners can improve their relational dynamics and work towards a healthier, more stable partnership. Whether facing minor acts of rebellion or serious criminal activities, the path to better understanding and managing these challenges lies in compassion, clarity, and informed action.